Good afternoon. My name is Latroyce Holland, and we will be discussing coronary heart disease in rural populations. Coronary heart disease, also known as coronary artery disease and ischemic heart disease, is caused by the buildup of plaque in the coronary vessels. According to the Centers for Disease Control and Prevention, coronary heart disease is the most common type of heart disease in the United States. The plaque substance developed from a complex atherosclerosis process that slowly builds in the arteries and eventually leads to reduced oxygen to the heart. The lack of oxygen to the heart tissue can lead to heart attacks. For some people, the first sign of coronary artery disease is a heart attack. Symptoms of coronary artery disease include chest pain, shortness of breath, pain in the arms, shoulder, and neck. Cardiovascular disease has a large health mortality and an economic burden. For instance, heart disease is still the leading cause of death in the United States for both men and women. Risk factors for coronary artery disease are both hereditary and modifiable. Research has shown that the atherosclerosis that causes coronary heart disease is the result of repeated inflammation and inflammatory events. The inflammation develops from insult to the coronary vessel endothelial wall, which activates immune cell infiltration to the injured site and promotes a cascade of inflammatory events, which causes a lesion or plaque formation. Through constant inflammation, lesions progress, which in turn causes immune cells to die. Once the immune cells die, lipid-laden macrophages create a lipid-rich environment with the coronary vessels, which can harden over time and reduce the delivery of oxygen to the heart. The treatment of coronary heart disease involves several procedures and medications. Hypertension is an elevation in arterial blood pressure. Untreated hypertension has a strong link to all forms of heart disease. Elevated pressure forces the heart muscle to pump harder, which puts considerable stress on the cardiovascular system. 47% of all cases of coronary artery disease involve hypertension. Cholesterol is a sterol that is found exclusively in animal products. Cholesterol should be limited, particularly in those who have a predisposition to heart disease and metabolic syndrome. Fast food, highly processed foods, and fatty snacks like chips and donuts are very high in cholesterol. Rural residents are at significantly greater risk for poor nutrition and nutrition related chronic disease. Data suggests that rates of diabetes are 17% higher in rural areas than in urban regions of the United States. The strong link between diabetes and cardiovascular disease helps to explain why heart disease is more prevalent in rural regions of the United States. Aging is associated with changing in the mechanical and structural properties of the vascular wall, which leads to the loss of arterial elasticity and reduced arterial compliance and may subsequently lead to coronary artery disease. Carrying too much weight can put extra stress on your heart, increase the risk for narrow coronary arteries, and affect your heart rhythm. Smokers in rural regions are more likely to smoke 15 or more cigarettes per day. It has been reported that smoking as few as 5 cigarettes per day increases the likelihood for developing cardiovascular disease. As mentioned earlier, rural residents are at a significantly greater risk for poor nutrition and nutrition related chronic disease. The development of rural land for recreational purposes provides the opportunity to promote physical opportunity. With the lack of recreational space, rural residents tend to stay in areas where physical inactivity is common. Coronary artery disease is commonly treated through revascularization procedures such as coronary angioplasty combined with arterial stent placement or coronary artery bypass grafts. Medication prescribed for coronary heart disease work primarily to treat the underlying causes of the disease such as hypertension, dyslipidemia, and diabetes. Prevention through healthy lifestyle change is the best method for reducing risk of developing coronary heart disease. Lifestyle changes such as exercise or diet and quitting smoking and drinking are commonly recommended actions, particularly when recognized early. The burden of coronary heart disease, although the leading cause of death in the United States, impacts populations differently. There are substantial differences in prevalence and mortality rates of cardiovascular disease, for instance, by race, ethnicity, rural urban residents, sex, gender, and socioeconomic status. The difference in urban versus rural prevalence of cardiovascular disease has been a topic for years due to the high mortality rates and high rates of hospitalizations in rural areas compared to urban rates. The American Heart Association, which highlighted the rural residents have a higher prevalence of heart disease and higher mortality rates from cardiovascular disease and stroke, and that gap between rural and urban areas by many markers has gotten wider in recent years. It has been proven that inequities exist across different geographic regions of the United States. According to the Centers for Disease Control and Prevention, the states in the southeast region of the United States have higher mortality from cardiovascular disease than those of other regions. In a publication on cardiovascular disease burden in the United States between 1990 and 2016, it was reported that it took 25 years for southern states to achieve levels observed among the healthiest states. These findings demonstrate that cardiovascular disease burden has improved in regions that have the greatest prevalence, but disparities between the states have not changed in the past 25 years. The burden that cardiovascular disease has on individuals living in rural areas has improved over time. However, the disparities that individuals in these areas face have not changed. Possible causes for the cardiovascular disease disparities in rural regions are limited access to treatment, heightened risk for cardiovascular disease, for example, obesity, inactivity, poor nutrition, hypertension, and smoking, along with socioeconomic status. Tracking the impact of cardiovascular disease is difficult in rural areas due to the lack of proper documentation. Coronary heart disease death rates have been decreasing among Americans aged 35 to 85 over the previous decades. However, the death rate has declined faster in urban areas than in rural areas in all four regions of the United States. Healthcare delivery, risk factors for cardiovascular disease, and socioeconomic status of individuals living in rural areas are instrumental for consideration as to the difference in the mortality rate differences between rural and urban residents. The way healthcare is received and delivered in rural areas is a major factor when considering the burden that cardiovascular disease, specifically coronary heart disease, has on rural areas. Many aspects of the healthcare delivery system and the communities themselves that affect cardiovascular health may be different in rural areas, including the availability of hospital care, distance to the hospital, and availability of transportation, quality of hospital care, lack of availability of diagnostic testing and relevant expertise, availability of outpatient post-acute care, availability of clinicians and insurance coverage, or the ability to pay for care. Rural regions of the United States tend to lack health care coverage, which contributes to the impact of cardiovascular disease. It is estimated that nearly 10% of Americans living in rural areas do not have health insurance coverage, and that many of these people delay receiving health care due to cost. Individuals not receiving health care are likely to live with comorbidities, such as hypertension, that increase the risk of coronary heart disease. Medication management also tends to be an issue pertaining to healthcare coverage, which affects treatment of cardiovascular disease and other health issues that may increase risk. Further complicating rural habitants' health-related treatment is that many providers in the rural regions do not accept charity, insurance, or low-cost insurance that many rural residents receive coverage under. There have been several national programs and initiatives implemented to help reduce the burden of cardiovascular disease in the United States. Million Hearts is a national initiative to prevent 1 million heart attacks and strokes within 5 years. It focuses on implementing a small set of evidence-based priorities and targets that can improve cardiovascular health for all. The Million Hearts 2027 priorities include building healthy communities, optimizing care, and focusing on health equity. The Cholesterol Management Change Package is a part of the Million Hearts Initiative. It presents a list of evidence-based process improvements that outpatient clinical settings can implement as they seek optimal cholesterol management. The cholesterol management change package is composed of change concepts, change ideas, and evidence or practice-based tools and resources. The hypertension in pregnancy change package presents an evidence-informed listing of process improvements with accompanying tools and resources that outpatient clinicians and care team members can implement as they provide care to pregnant and postpartum women and women of reproductive age with a focus on early identification, optimal management, and prevention of complications of hypertension in pregnancy. The CDC Foundation teamed up with the Million Hearts Initiative to implement the Live to the Beat campaign, which is a national cardiovascular disease prevention campaign that focuses on reducing the rate of cardiovascular disease among black adults aged 35 to 54, a demographic which experiences disproportionately the high rate of heart disease and stroke. It emphasizes lifestyle modifications such as moving more, eating better, quitting smoking, and addressing key risk factors like hypertension, high cholesterol, and high blood sugar. The Healthy People 2030 initiative has several objectives listed. For example, increase cholesterol treatment in adults, reduce coronary heart disease death, reduce the proportion of adults with high blood pressure, increase aspirin use for secondary prevention of atherosclerotic cardiovascular disease, and to increase the whole grain consumption by people aged 2 years and over. All of these programs and initiatives can be used to reduce the disease burden that cardiovascular disease and coronary heart disease have on rural populations. Thank you all for your time. Please see my list of references.